Welcome to Unscripted Let's Talk, episode 13. My name is Mary Eggleston, and I am again here with Rachelle Broveleit, who is a physician assistant over at Sanford Psychiatric. And she was talking with us in the last episode about medications and how they're used for depression. We're going to continue with some of that, and we're going to add what we do in terms of medication with regard to anxiety. And then go kind of see where that all takes us, right, Rachelle?
Perfect.
Yeah, and so I'm just thrilled that you're sitting down again with me.
I'm glad to be here.
And you had said, after we were done last time, that you had wanted to speak to the idea of people feeling weak and embarrassed.
Yes. So on the introduction of the last episode, you had brought up that sometimes when they're coming from therapy and they're coming to see us in psychiatry, that one of the things people will say is they're worried about starting medications and how that might make them look weak or make them look like there's something wrong with them or make them feel embarrassed. And so I try to have a conversation in those situations where, in my experience in psychiatry, folks who are experiencing mental health symptoms and then get treated for mental health symptoms, I feel like are actually the strongest people. So I feel like it takes great strength to do all of this. And so actually going to take a medication and taking it every day and being a part of that process, I feel like for sure only shows strength. And I give examples of people who, an example I've used a lot recently is Kevin Love. He's a professional basketball player who has been very vocal about his mental health struggles and taking medications and looking at that. That's a group of people that we've always seen as, big and strong and masculine, and yet he's making himself very vulnerable. And I think in that, to most of the world, appears stronger. I think everyone's kind of surprised at how strong he seems by just sharing that. And so I try to share those things with people to point out that it isn't a weakness. And as far as feeling defective, I will say that I'm a provider also who always acknowledges that person's feelings, like that it's normal as a human. When you go into any doctor's office or the dentist office or wherever you're going, the eye doctor's office, to feel defective in some way because of whatever you're having to treat. And certainly there's more stigma with mental health issues than other things, but that the world is shifting, and that again, we're being seen, I think, when we're really working on these things as people who are moving forward and progressing and growing rather than people who are stagnating. And so I'll try to point that out. And I kind of wrap the feeling of embarrassment into that also, again, trying to validate that embarrassment is normal as a human. You're going to feel that, but that it doesn't make a whole lot of logical sense to stop yourself from something that can help turn your life around due to the feeling of embarrassment. And then usually people will start to soften with that. So I definitely have a way. I'm sure Mary has a way that she goes about that also in her practice, as far as trying to help people to see that this can be the best path, and that it doesn't necessarily have to be a negative thing. Like, I've had so many people whose lives, I think, have totally changed just by the medications we're using.
Yes. One of the things that I say to people is we can keep talking and talking, and you can do the old pull yourself up by your bootstraps or suffer through the day. But if you have something biochemically going on, we need a biochemical response.
Yes.
And why would we deny ourselves the advances that have happened?
For sure.
And what is strength except to be able to speak whatever the truth is? Mm-hmm. And so you're right, Rachelle, that's how I think of it too. When people come in for therapy, they have already moved through any number of things to be able to just walk in and take a seat. And
yes,
it's the stronger person who actually wants to become self-aware and be more of who they really are that comes in. The other people aren't coming in.
Exactly.
So
exactly.
Yeah.
Yep.
Okay. Well, I'm glad we said that. So drug interactions, and especially, what about the use of alcohol?
Right.
When people are on these medications.
Right. So alcohol is an interesting topic, because when you go to the pharmacy, the pill bottles are going to say do not use with alcohol for many medications, for a large host of them. And the reason that they say do not use alcohol is varied from med to med. So I will tell people there is one group of medications that I use regularly. Those would be what we call benzodiazepines. Those are medications that we use for anxiety. People know most of them as Klonopin, Ativan, Xanax, Valium. Those are probably the most common. Those medications we do not use with alcohol. The goal is to not use those medications with alcohol because they actually work on the brain exactly like alcohol does. So they are basically a pill form of alcohol. And the problem with something like alcohol and a benzodiazepine is that both of them cause respiratory depression. And so people, if they take, they have a glass of wine, they take a Klonopin, they have another glass of wine. Now they're forgetting what they've taken. They take another Klonopin. So you lie down and go to sleep, and you have the possibility of never waking up because your respiratory rate has slowed so much that you actually just stop breathing. And so it's hard to get to that place with alcohol alone or with the benzodiazepines alone.
But the
The
combination.
combination is what is the challenge. So those meds should not be used with alcohol. So that is true. When it says on the bottle, do not use with alcohol, totally true. One of the places we get in trouble is with antidepressants and even other meds that we use like mood stabilizers and antipsychotics, those type of meds. Lots of times the bottles will say do not use alcohol. In my experience, if someone is having a problem with quitting alcohol, generally speaking, they should be still taking their medications. They should still be taking their antidepressants, mood stabilizers, antipsychotics. They should still be taking them all. And they should be having conversations about how that feels with their provider. So we want to make sure that the provider is aware of this, but we definitely don't want people, because they're drinking 4, 5, 6 times a week, to be skipping their medications 4 to 6 times a week. Because of course, right there, then we're going to end up in trouble. And so, and it's, if you are depressed or anxious or having mood fluctuation issues, it makes it even harder to quit drinking. So we definitely want you to be taking your meds, and then we want you to be having conversations with your provider about how it feels when you do take the meds and alcohol, and what can we do to remedy the situation.
So an occasional drink of alcohol, and you're on an antidepressant.
Exactly. So an occasional drink, if we're talking antidepressants, an occasional drink is not going to be a problem. The one thing I will say is there is definitely evidence that the effects of alcohol will show up sooner. So if you're a person who would go out with friends and you would have 3 drinks, I definitely tell people start with 1 and see how things go. So if you're like going out a few times a week with friends, yes, I mean, it's not that you can't have alcohol, you just might slow down the amount that you do. And you do have to be very careful. I mean, a lot of people will say, well, I go out with friends, and if I only have 1, then I drive home. You want to be very careful with that, because 1 might impact you more and driving home might not be appropriate.
Oh, wow.
So being very careful with that.
Yeah.
Yeah.
And so it's really about staying tuned into your particular response.
Exactly. You need to know what it looks like, so you definitely want to just start on the side of being conservative. Start with, the lowest amount. And then if you find that it's okay to have 2 drinks, but again, then most people with 2 drinks don't drive, that type of thing. But if you have 2 drinks with the antidepressants, you just have to be careful, because you might want to have a friend or a spouse or someone look out for you a bit on how you're reacting to it.
Yeah, just stay aware.
Stay aware.
It's always about that.
Exactly.
So anxiety is so often linked with depression.
Yes.
And then you've already referenced some of the meds that are used for anxiety. So just speak to, like, when somebody comes in and what they're presenting, the main thing they're presenting is anxiety. What do you do with that?
So, first of all, the first thing you said is there is a ton of overlap. So I have a very, very large group of people who are having both depression and anxiety. So if you feel like that's a possibility, you're correct. So if you're having that feeling, definitely investigate both. I pretty much, if I'm seeing someone and their chart just says that they think they have depression, I will always go into the anxiety questions, because there's a lot of comorbidity there. So when I'm looking at anxiety, this is a state that I will frequently have people say, I don't really know what that means. I don't really know what anxiety is. And so anxiety, as I describe it to people, it's a pretty big umbrella of diagnoses. The most common of them probably is what we call generalized anxiety disorder, and that's what I call the worrier's disorder. That's the over-worrying, overthinking, borrowing trouble, that kind of thing. And so I'll go into the questions with that. A very common thing that I'm seeing a lot of today is social anxiety. And a lot of people don't even necessarily know that that's what the problem is, but I've started asking more questions about that, because if you are a person who avoids every social situation you can, and when you are in one, you can't wait till it's over, and the whole time you're there, you're feeling judged, you might
Which are some of the questions you ask.
Exactly.
I was about to say, what are some of the questions you
ask?
ask?
Those are my questions.
Yeah.
And then we find out that you might meet criteria for social anxiety disorder, which doesn't always help. I mean, I'm going to treat the anxiety anyway, but that also will probably require some therapy to work on, because it's a tough state to work on with just meds. And then there are some other things. Panic disorder would probably be the next one. I have a lot of people who have panicky symptoms and some panic attacks, but maybe wouldn't meet a full panic disorder diagnosis. But that is a physical feeling of anxiety. So when people are telling me my heart races, I sweat, I shake, I feel nauseated, I'm dizzy.
They feel physically paralyzed.
Physically paralyzed, yes. That's the panicky end of things, and that can be in conjunction with the excessive worrying, and also in conjunction for sure with social anxiety. Because a lot of times people, when they get socially anxious, they start feeling panicky. Then the next extension I would say is OCD. That is a state where you have obsessive thinking and you have compulsive behaviors. So you do repetitive things to try to release the anxiety that you're feeling from those obsessive thoughts. Obsessing being thinking about the same thing over and over again, and not wanting to think about it. So sometimes for people that's happening. And if you're feeling that way, definitely bring that up with someone. I have a lot of people who don't share that.
Yeah, that's really the key, that last part that you said, where you're obsessing about something and you don't want to.
Yes.
And you cannot stop
the
thinking about it.
Negative thought. It's a negative thought to you. You don't want to have the thought, but you cannot stop it.
Right.
Yeah. And then the last group that I would say kind of falls under anxiety, but is definitely a little bit farther out, is the post-traumatic type symptoms. And so we all know PTSD as an acronym. And so you've had a trauma happen, and then you have these anxious symptoms because of it, which then overlaps a lot with the excessive worry and the panicky feelings and those types of things. So those are the questions I ask. And then as far as medications go for anxiety, people are often surprised to hear that the same meds we use for depression are also our bread and butter medications for anxiety. They've shown to be, and I think what we then can take from that is that likely it's also serotonin and norepinephrine that are the crux of the problem for anxiety, just like they were for depression.
And that you have a deficit of those things.
Exactly. So the lower amount of those, you need more.
Right. I bump into that a lot. People think, well, I don't want to be on an antidepressant. I have anxiety. And I try to explain that to them, that it is the same deficiency that you have going. And we have to get that. So,
and if you look at the studies, they initially did studies for depression, and then they went back and did all the studies for anxiety disorders, is how that rolled out with the different medications. And so some of them are more helpful than others to a certain extent with different types of anxiety. Generally speaking, we have to use a little higher doses for anxiety than we do for depression. Depression will usually respond earlier than anxiety will, so it takes a little bigger dose. With the anxiety. Then beyond that group of meds, so that we talked about in the last episode, those are the SSRIs, the SNRIs that we talked about. Beyond that, then the other group of meds that we use a lot for anxiety are the benzodiazepines that I talked about. And that group of medications is amazing for anxiety. The problem is that it brings with it baggage as far as being an addictive substance.
yes.
So so we have to be very careful with them. If you take a benzodiazepine all day, every day, your body will become dependent on it. You will not be able to stop the medication without weaning off of it. If you did abruptly stop it, there is a possibility of seizures and death. So it's really important to not take a bunch of these medications and then stop them abruptly. So you want to work with your provider. But that being said, they are an amazing group of medications. And so I have a lot of people who I think, the way that they function in their day-to-day life with going to work and dealing with family and everything is by the help of some of these medications.
And so the key is take it as it's prescribed.
Exactly.
And again, don't play with your meds.
Yes.
Don't start making your own decisions
Yes.
about your medications.
No.
Don't do that. I see that with so many people.
Yes.
Well, so I decided I would just take it this way. And I think, no, don't do that.
Yeah, I don't prescribe my own medications for myself.
Right.
So you being at home prescribing your own meds doesn't make sense. Like,
No.
they don't allow me to do it for myself. I have to go see a provider. So we wouldn't want anyone to decide that. And in the climate of today, post the opioid crisis, the minute you start messing with things like a Klonopin or an Ativan, a benzodiazepine, the minute you start playing with that and doing what you want to do as a patient, it becomes very difficult for providers and pharmacists to trust you.
Oh,
Very
that
difficult.
makes sense.
Because they're controlled substances. And so I tell people all the time, I am watching what you do with this medication, but the government is watching me. So like the government is monitoring my license for all of these medications. And the same thing with the pharmacist. Mm-hmm. So we're all being watched by someone because you need to have oversight on these things. And so people will come back and be very frustrated that the pharmacist is looking at them a certain way, or that we have said something about overuse of medications. But if you have to take a medication differently than it is prescribed, you must contact the provider right away to get them into the loop.
Right. Or you're going to run into difficulties.
Yes.
Okay. So, Rachelle, are there natural treatments for depression and anxiety, like herbal treatments?
Right. So probably the one that has probably the best evidence is St. John's wort, and it acts very similarly in kind of a less potent way than like to your Prozac, Zoloft. It acts like an SSRI basically. And there is some effect from that. I've had a few people who are not, comfortable with pharmaceuticals, and so they've tried St. John's wort. The challenge I've run into with that is that in being worried about taking pharmaceuticals, it's often just being worried about taking pills in general. And so it's just hard to sometimes get that decision made that you're going to take a med every day to help. But they do have a similar effect. So I definitely tell people, if you're going to use St. John's wort, you need to let me know, because I don't want to give you other meds that are going to cause side effects because they're being used together. So that's a big thing. There are some other supplements that theoretically could be something that would help increase something like serotonin or norepinephrine. The problem with them is most of the time we don't have good evidence. So we have, a lot of people don't know that the FDA sees supplements and vitamins as a food product, not as a medication. And so they don't have to go through the same rigors of being studied. In fact, they really don't have to be studied at all, and they can make almost any claim they want and put it on a bottle. So if you're looking at, I say to people, I understand you don't want to take a pharmaceutical, but we actually know what this does. And we actually know what it causes. And we actually know, we're in the know. That is not true of supplements and vitamins. Like, we don't really know, and people can say almost anything. So not to say that there isn't some benefit, and there have been some studies done for certain supplements, but it's not nearly as robust of the information we get from the pharmaceuticals.
Have you read anything about magnesium and its link with being good for reducing anxiety? Have you read
I have
anything like
not
that?
read. I've heard that from people, and I have some people taking it.
I've heard that too.
It again is, it as far as I know, falls into that kind of its anecdotal information
Yes.
at best. It's not heavily studied in randomized controlled trials. A lot of that has to do with the fact that doing randomized controlled studies is extremely expensive.
Right.
And so companies don't spend the time doing it when they're not held to that standard. The pharmaceutical companies don't have a choice but to do it. If they want to get a product to market, they have to do those
They have to
studies.
do it. And vitamin D?
So vitamin D, there is a lot of theoretical reason why it should work.
Yes.
It has not, though, proven to be this amazing cure for depression and anxiety that we originally thought it was. And I think some of it has to do with our, not necessarily understanding. There's a wide range of a normal level for vitamin D. And so it's hard to know, is this person's normal at 30? Okay, it's hard to know what that exactly means. I think that's part of it. I've seen people who are on the low end all the time, and they try to supplement them, and they still don't. And it might be an absorption thing. They might just never absorb vitamin D very well, and just their level never gets high enough to really show us what they would look like if they had a robust amount of it. So I don't know that anyone. What I can tell you clinically is There was a period 4 or 5 years ago where vitamin D levels were being studied rampantly, and everyone was giving lots of supplements of vitamin D, and I think almost no one was really seeing much of a change. And so I think we all kind of decided, why are we doing this? Like, if we can potentially be costing someone a lot of money and the effort it takes to take that med every day and then not seeing any benefit, why are we doing it?
On the other hand, you would agree that if somebody does experience benefit from vitamin D
100%.
and magnesium,
yes, it's definitely not. You want to be careful with, particularly minerals. You want to be careful with the amount you do. You don't want to do outrageous amounts of anything because you can have buildup and too much of it. But yes, if you're doing a fairly normal middle of the road amount of it, no worries. I definitely, you have to be concerned if it is difficult for you from a budgetary point of view. You have to be concerned about these things because you can spend an outrageous amount of money on supplements and vitamins, and you can often get very little for that. So if you're getting something great, awesome, keep doing it. If you're not really getting anything, you want to look at if this is costing me $60 to $100 a month, is that money well spent?
Yeah, good point. And light therapy?
Right. So there's some good evidence for light therapy. And I would say I have folks who, I have a wide variety of responses, which is actually what the studies looked like. Some people get a ton of help out of it, and some people get a very small amount. I am usually seeing it, of course, in people who are using it in conjunction with medication. So then it's a little bit hard to tell, is it the meds, is it the light that's helping? But for sure, there is a good benefit for people. Any person who starts to notice an issue in, late October, early November, and then starts to feel much, much better in, like February into March and April, that is a sign that the days getting shorter is a real challenge for you. And so I have people kind of go do the research on Amazon. There are a lot of affordable options.
There are now.
Now it's really great. And I've had people, I think, like I said, feel like it's a ton of help.
So, of course, I think psychotherapy also really helps people with depression, anxiety, and all these other things that we're talking about. And I'm pretty sure that you think so too.
I definitely do. From a personal standpoint, I've seen how beneficial it can be. That's one of those things when practicing medicine that we always bring up. Do we share our own experience? And that is one of the few places that I do actually share my own experience with people sometimes. I'll say to someone who's skeptical about doing therapy that I'm recommending therapy for them, not just as a person who prescribes meds and works in mental health care, but also as a person who's done both individual and marital therapy and found a great deal of benefit from it. So that sometimes helps people to maybe be a little bit more motivated. But in my practice, I would say the vast majority of my patients, I'm recommending some sort of therapy. Now, I have a wide variety of reactions to that. Some people can't wait to do it, and some people are very hesitant, and I probably have to do the reverse of what Mary does and kind of convince them, like, this could be really beneficial to you in all these ways, and I go down the list of all the things I think it will
Isn't
help.
that interesting? I'm on the end where I'm saying, I think we want to try some medication.
Yes.
And they're taking it as that means there's something really wrong with me, defective. You're on the end of,
For
well,
sure.
you're going to take a pill, you're okay with that, but how about if you talk to somebody?
Yes.
And that to them, I mean,
Is
it's
a
just
no-go.
the
And therapy
interpretation is so interesting.
Yes, therapy is one of those things, and that in a discussion with someone is also very hard. I've had people who have maybe seen a therapist or two. Sometimes they've only seen them a couple sessions. Sometimes they saw them for several sessions and had a bad experience. And then a person will often make the statement of, like, therapy doesn't work for me. Yeah. And so I often have to do the kind of backtracking of, therapy is many things. And it is as different as the therapist you're working with, right? Like, there's a lot of variability in therapy. And so going back to trying it again is one of those things that I'm frequently working with people on.
I tell people, don't give up on yourself.
Exactly.
Why would you give up on yourself?
Exactly.
So it didn't work here, or you tried one med from your primary care physician, it didn't work. Let's kick it up. Let's have you see a specialist.
Yes.
Let's try again, but don't give up on yourself. Keep
For sure.
going.
For sure.
Right. And then, of course, exercise, meditation, all of those things can be of
100%.
tremendous help to people.
Sleep, working on sleep hygiene. Sleep hygiene is huge.
Going
Diet.
all of that
All of
makes
that
a
is
huge
huge.
difference for people in terms of their depression, their anxiety, and just their
Exactly.
well-being.
And well-being.
Now, I have one last area that I want to ask Rachelle about. I don't know how thrilled she is, but tell me your thoughts on marijuana.
Right. So this has become, the last couple years of my practice has become a conversation that I didn't know I was going to be having as much as I am, because it's become a very, very commonly used product in all sorts of ways. So, like, of course, we're seeing marijuana and THC use, but we're also seeing CBD products. And what I would say the overarching message I feel like needs to be from psychiatry right now is that I tell people I am not saying that this group of products doesn't bring benefit, because I have had multiple people tell me how many benefits it brings. What I will say is that it usually brings short-term benefit, right? So it's usually used and to try to help in that moment. It's not always some of the negative things that happen with it are more of the long-term effect. So a lot of times there's this short-term calming, relaxing, kind of clearing kind of feeling. But long-term, there are some things to be worried about. So I will bring those up with people. But we need to be very hesitant to say exactly how much we know this is helping or hurting anything in psychiatry, because the amount of information we have so far is bleak. It was in being a controlled, what we call a C1 in the medical world. That means it was a controlled substance level 1, which puts it in the same group with things like heroin and cocaine and methamphetamine. The problem with that means that the government-sponsored studies that should have been being done for a long time weren't done. And now we have states changing all their laws to make this recreational and medical, and we don't have the information to back it up like we would like to have. And so, the most common thing that I hear people say to me is that it helps my anxiety, and it helps me sleep. And I'm not going to deny either of those things, especially in the moment. The couple concerns that we can have about it in regards to anxiety are that as if you get a particularly large dose of it, or if you're a person who reacts to one of the initial doses you take, you can have more intoxication from it. And that for some people can cause very, very high levels of anxiety and paranoia and agitation, which looks kind of the opposite of what we normally think about with marijuana use. But that can happen. And I've had multiple patients, especially people who have anxiety, who've had that reaction, and they will never try it again because it was such a horrible experience. So we need to be aware of that. The extreme of that is that sometimes when people have used large amounts for a long time, there's also a group of people that ends up with psychotic illness because of marijuana use. And I would say many folks who stop using then, if they get hospitalized or whatever, will have those symptoms go away. But I've actually had people where the symptoms never go away. So they are paranoid and sometimes having hallucinations for the rest of their life, maybe not as extreme as they were when they were using. So that is something to be very aware of. But probably more worrisome is the group of people who's using marijuana for anxiety. And what they don't understand often is that, yes, it helps in the moment to dampen down, but there's also evidence in some of the studies we do have that when the levels come back, so when the marijuana wears off, there's actually rebound anxiety that is worse than what you were having before. Like the levels will actually be higher. And this follows a lot of things that we know about anxiety. When we use drugs to tamper down anxiety, when those drugs come off, our brain lets up this big explosion of anxiety. And so that's why people will end up sometimes using more and more and more marijuana more and more often to try to never come off of it. Mm-hmm. Which then
this is about the people who are using it specifically for anxiety.
Yes, because I'm seeing a lot of that, right? In my practice, that's where we're talking about it in that type of environment. Yes.
Yeah. Wow.
So just being aware of that, not to say that there's not a place for it, and obviously lots of places are becoming recreational, looking like that in our state. And so with that, just using some caution if you have mental health issues. Mm-hmm.
Just as you would say to somebody in terms of using alcohol.
100%.
Use some caution.
Yes.
Some sense. My own thought with marijuana on a social level is it doesn't appear to be any more, as an addiction counselor, it does not appear to be any more addictive than alcohol is.
For
but
sure.
hello, people, alcohol can be really addictive. You got about 10% of people who drink who will become alcoholic.
Yes.
The number is likely the same with marijuana. And as a friend of mine says, you can like that number, you can hate that number, it won't change the number. And so, I mean, that's just a reality of it. So those are some really good thoughts.
Yeah,
Michelle,
and
thank
you brought up, I think, one of the things I've been talking to people about. I think there was in our culture this desire for a long time to distance. Well, first of all, there was the desire to connect marijuana use to all of the other drugs of abuse. And I think any of us who work in this field know that that really doesn't make sense. I don't see a lot of that. I don't see a lot of marijuana users becoming heroin users.
No.
So that doesn't make a lot of sense. But I think there was a desire, I think, to distance marijuana use from alcohol use, as far as like, it's not like alcohol. It's a different thing. But I can tell you sociologically, when I watch it, it looks like alcohol. Mm-hmm. Like they are very similar. They obviously have very different effects on the brain and effects on people, but they are very similar in how they act, as far as using them socially versus using them in a way that's addictive versus, just all the different aspects. So if you want to know kind of what it's going to look like years down the road with the group of people using marijuana, look, I think, at what alcohol looks like.
That's right. That's
It's going
right.
to look that way.
Yeah, it is. And so we need to be aware of that as we go forward.
Right.
With whatever we do in terms of legality here in South Dakota or elsewhere.
Exactly.
So, and then finally, there are these right on the edge studies being done with psychedelics.
Right.
And especially with mushrooms.
Right.
And hallucinogens.
Microdosing.
Right, microdosing, and the idea that will that reset the brain, with persistent and difficult depression.
Right.
And I know that those studies they're brand new, and yet I have read of them. And so what are your thoughts?
Well, and I think, if the studies do look promising, which some of the precursors that came before this were LSD studies, right? Like there was that whole, and that became difficult to kind of tease out exactly what was going to happen. So I think those of us in the field would be super happy to have something that helps reset someone's brain after depression. Like if we can find something that has really good evidence. So that's the whole thing that I would say about any of these things is we're going to hold things like marijuana and things like
The
microdosing
psychedelics.
we're going to hold them to the same standard we would hold a pharmaceutical. Mm-hmm. And so that's the deal, is like, we're not going to say that they're not beneficial, but you're going to have to meet the rigors.
Right.
Your studies are going to have to look like
And
our
that's
other
what we
studies look.
count on the medical field to do, is to, before you approve of something, it has truly been studied and it's truly been looked at and tested and everything else. And that's the beautiful thing about going to someone who does what you do.
Right. I mean, I'm trying to use evidence every day, and I am fortunate to work in a staff of people who likes to read about evidence and likes to search things out. And so we talk to each other frequently from an evidence point of view. Do we have good evidence for this? And so we're trying all the time to keep ourselves up to date on that. So if we come out with good evidence from THC or CBD products or from a psychedelic, I don't think any of us are opposed to using them. We just want to have good evidence.
Right. That makes so much sense. Thank you so much,
Thank
Rachelle. This was so wonderful to have you. It was great fun. I learned a ton. I told Rachelle in between the episodes that I've had a hard time holding on to what my question will be, because I am sitting here just transfixed, listening to everything she has to say. So I hope that our listeners enjoyed it as much as we did.
And that it was helpful and gave you some good information to be armed with.
Yeah, wonderful. So thank you, and maybe you'll come back
Maybe I'll
again.
come back.
Maybe. I mean, feel free to send us an email. Send it to unscriptedletstalk, all one word, @gmail.com. And remember, live your life with passion, intention, and purpose. Until next time.